Fox 61 Morning News begins now.
Well, up next on Good Day, Connecticut, not exactly great breakfast topic to discuss, but it is a necessary health topic to discuss. There's a month-long effort to raise awareness about colon cancer and how to prevent it, the screening that may save your life someday. We'll have advice from a doctor from Bristol Hospital coming up. I'm back now, 9:47. March is Colon Cancer Awareness Month, and here to talk about the facts and the critical importance of getting yourself tested if you're at the right age is Dr. Peter Bloom from Bristol Hospital. He's the chief of endoscopy there. Thank you so much for joining us today.
Thank you for having me.
Yeah, glad to have you here. We talk about different types of cancers a lot. Some of them have effective screenings, some of them do not. I guess colon cancer is one where absolutely screening could save lives, yes?
It's a cancer that can be screened, and there aren't many. Prostate cancer, breast cancer, and colon cancer are three where there are screening tests available. And because of that, both the incidence of colon cancer and the deaths from colon cancer have gone down considerably over the last 10 to 20 years, due in large part to colonoscopy. It's a very effective test both to detect precancerous lesions as well as colon cancer, and we have the ability to both observe and remove small polyps before they grow into tumors. So it's very important, a very effective test.
You mentioned that the incidence is going down. How common is it, and where does it sort of compare to other cancers?
In 2016, there were 135,000 cases of colon cancer diagnosed, and approximately 19,000 deaths from colon cancer. And they both rank in the top 5 amongst cancer-related statistics. So it's a considerable health burden in the country. But that's much better than it was, in fact, 20 years ago.
Yeah. Okay. Now, for people who are not aware, are they saying, should I go out and get myself tested? Should I get the colonoscopy right here? It's not necessarily that simple, right? Is there still that age threshold?
There is. Currently, there are screening guidelines for people age 50 and older. Okay. That's the typical age in which people reach the average risk for colon cancer, and that's the age where your doctor would recommend that you have some sort of screening test. Yeah. There are other screening tests available. There are stool tests that detect microscopic DNA that might be shed from a tumor. There's also stool tests that will detect microscopic blood in the stool. These are good, but they detect mainly large polyps and cancer, as opposed to the colonoscopy, which detects small precancerous polyps.
Okay.
But it's age 50 is where we start screening.
So age 50, you're suggesting people get a colonoscopy regardless. We don't need any symptoms. That's just because you're 50.
That's correct. And that comes up a lot. Patients often ask me, well, why do I need this? I feel fine. And the answer is that small polyps that could grow into tumors will not cause any symptoms. So the best time to have a colonoscopy is when you feel well and you don't have rectal bleeding, change in bowel habits, or anemia. And those are symptoms of advanced colon cancer. Now,
before you're age 50, those other tests you're talking about, the stool test, the blood test, the DNA test in the stool, those are if you do have symptoms?
If you do have symptoms, they're not specific for colon cancer, but rectal bleeding, a change in the caliber of the stool, anemia, those are some very important symptoms not to ignore. And even if you're not age 50, a colonoscopy would be the test of choice if you have some of these symptoms that are ongoing. It turns out that colon cancer does exist in people younger than age 50, and it's somewhat alarming, but the incidence of colon cancer is going up in younger people. People in their 20s and 30s right now are being diagnosed more so than they were generations ago. And it's concerning because we don't have a screening protocol in this country right now for people that age, so there just has to be a heightened awareness for people who have symptoms.
Okay, that is interesting. Yeah, talk to me a little bit more about the symptoms. I apologize in advance. Like I said, it's not necessarily polite breakfast conversation. With your bowel movements, what should we be looking at? You mentioned bleeding. Does it come out red?
It does.
Or does it come out black?
Usually red. The stool may be a black color if the tumor is higher up in the colon.
Yeah.
Rectal bleeding is not a specific sign or symptom of colon cancer, but it's one that could be. So it's one that shouldn't be ignored. The bowel habit caliber can change. Typically, if someone is used to being regular in terms of their bowel habit pattern and then they become constipated for no reason that persists more than a few days, it doesn't mean you should run off to your doctor, but you should be concerned about if it persists.
Finally, how do you initiate this? Is this something you have to ask for if you're above 50? Should you wait for your doctor? And what do you do with insurance? I mean, is this prohibitively expensive if you're...
Screening colonoscopy is generally covered by all insurance. Your physician would recommend it when you turn 50. You don't have to wait. You can initiate the conversation. We have a system at our hospital that's called open access where you can actually make a phone call and set up a colonoscopy. As long as you meet the criteria, age 50, then the process can be initiated.
Okay, so if people want to come to Bristol Hospital, there's just a phone number, I believe, that they can call. I don't know if you know it off the top of my head. We do have it on our website, which is why I wanted to mention it. I don't want to put you on the spot. But
yeah, I don't remember it off the top of my head, but it is there. We have the endoscopy unit at Bristol Hospital has attained a center of excellence called the Endoscopic Unit Recognition Program, one of only a few in the state. So it is a sign of high quality and safety at the center. I also do procedures at Central Connecticut Endoscopy Center in Plainville, also a center of high excellence.
Okay, wonderful. So again, the reason why I mentioned that, it's on our Fox 61 app, as all the critical information you need about this is. So just go right there, and the takeaways: if you're over 50, get yourself that colonoscopy, regardless of whether you feel fine or whether you don't. Doctor, thank you so much.
Thank you very much.
Pleasure to have you here. All right, still ahead on Good Day Connecticut here on Fox 61. We're going to take a